Hello, my name is Christina Aponte, and this is my Module 3 discussion on microbes. What drug-resistant microbe have you chosen? I have chosen C. diff or Clostridium difficile. It is a bacterium that can cause diarrhea and colitis or inflammation of the colon. What drugs are your microbe resistant to? And is it a multi-drug resistant microbe? As per the National Library of Medicine, the choice of antibiotic therapy depends on the severity of the C. diff infection. There is a specific strain of C. diff. It's called ribotype 027, and that has become a problem in treating C. diff infections. And also, C. diff spore formation may also allow the infection to survive, and that leads to the reason why the infection cannot be controlled or antibiotic therapy might fail. C. diff is a multi-drug resistant infection. Some of the medications that is resistant to are tetracyclines, erythromycin, clindamycin, and cephalosporins. How does your microbe spread? As per the CDC, C. diff sheds in feces, any surface, device, or materials such as commodes, bathtubs, or electron rectal thermometers that become contaminated with feces could serve as a reservoir for the C. diff infection. Then C. diff spores can also be transferred to patient via the hands of healthcare personnel who have touched a contaminated surface or item. What kind of infections does your microbe create? As per the CDC, the type of infection C. diff creates can cause pseudomembranous colitis or PMC, toxic megacolon, perforations of the colon, sepsis, or even death. How lethal is your microbe? How are cases trending? C. diff is in a list called an AR threats report. That is a report from the CDC. AR stands for antimicrobial resistant report, and as per this report in 2017, 223,900 estimated cases of hospitalized patients with C. diff, and from that 12,800 estimated deaths in 2017 from C. diff. Improving antibiotic use may have contributed to the decrease in long-term care facility onset of these cases. So basically, medical professionals have found out, if they are more careful in prescribing antibiotics initially, if one patient is found to have C. diff, they usually are not treated fast when they're on the antibiotic. On the other hand, if a patient has been prescribed correctly with antibiotics, meaning they should be on antibiotics, not giving patients antibiotics for no reason, that has made a decline in cases of C. diff. Just a little more clarity. Why has your microorganism become antibiotic resistant? When a patient is in a long-term care facility, they could have already been on antibiotics. Once C. diff infection is discovered, the antibiotics would not work readily on that patient. What is being done by medical science and others to combat your microorganism? Medical professionals are being more careful in prescribing antibiotics. Medical professionals are also aware of C. diff, so they have protocols in place. If you have a patient that's had 3 bowel movements within a 24-hour period, those patients are tested for C. diff. And if you detect an infection early, you can control the spread. What can we do as consumers to combat this spread? Us as consumers, we need to practice good hygiene and also wipe down common surface areas, and plus, back to the good hygiene, wash our hands. Thank you.